the first fill. My name is Katie Meyer, and I serve as the Senior Director of Content Creation here at APHA, and I'll be the host for this episode. This month, we're going to try something a little bit different, and we'll release 2 different podcasts. Today, during part 1, I'm joined by APHA Executive Education Fellows Nicholas Bennett Brush and Yara Alsher. Welcome, Nick and Yara. Why don't you introduce yourselves?
Yeah, hi everybody. I'm Nick Bennett Brush, one of the education fellows here at American Pharmacists Association, recent graduate of University of Missouri Kansas City School of Pharmacy.
Hello, everyone. My name is Yara Alsher. I'm the other education fellow here at the APHA, and I'm a recent graduate from Mass College of Pharmacy and Health Science.
Thanks for that. So today, during part 1, Nick, Yara, and I are going to talk a little bit about fall prevention, and we'll discuss the recent U.S. Preventative Services Task Force recommendation statement regarding interventions to prevent falls in community-dwelling older adults. During part 2, I'll welcome an expert in the field who's serving older adults as part of his practice to talk about interventions and practice pearls for pharmacists who also serve or are looking to serve the population. So let's dive in. Just a bit of background to get us started. Per CDC, falls are a leading cause of injury among adults aged 65 years and older in the United States. Looking at data from 2018, falls in older adults lead to an estimated 3 million emergency department visits, more than 950,000 hospitalizations or transfers to another facility, and approximately 32,000 deaths annually. And unfortunately, the CDC also notes that the deaths from falls are increasing. There are several factors that contribute to a patient's increased risk of falls as they age. These can include things like chronic health conditions related to falls, functional decline, and increased use of medication. This is obviously a major problem, and as pharmacists, we are well equipped to take the lead in fall prevention efforts, especially that increased use of medication risk factor, as polypharmacy is a problem that we see every day. This brings me to my first question, Yara. How does the prevalence of polypharmacy in older adults contribute to a patient's risk of falls?
Thank you for this question. So I'll first start with defining polypharmacy, which is the practice of taking 5 or more medications at the same time, and it's quite common among our older adults. Research, in fact, shows that when aging individuals are on 5 or more medication, their risk of falling significantly increases. Studies consistently show a strong link between polypharmacy and a higher risk of falls. In fact, recent data highlights that nearly 15% of older adults who end up in the hospital due to falls were found to be on a higher number of medications. Now, the more medications a patient takes, the greater the chance of negative drug interactions, and these include dizziness, low blood pressure, and confusion, all of which makes falls more likely. Additionally, certain medications, especially those for heart conditions, CNS issues, pain management, endocrine disorders, can have side effects that further increase the risk of falling. Older adults, especially those with multiple health conditions, often need to take several medications, which puts them at even a higher risk of falling. This is why it's crucial for pharmacists to be vigilant, review and adjust medication regimens as needed, and provide proper counseling to help reduce this risk.
Yeah, Yara, dizziness, hypotension, confusion, these are all certainly ADEs I've seen in my practice when serving adults with polypharmacy. So, Nick, what are some suggestions for pharmacists to identify polypharmacy and how to intervene to reduce the patient's risk of falls?
Yeah, so pharmacists, they should perform a comprehensive medication history with the patient in which they identify potentially inappropriate medications. Things that they could look for include duplicative therapy, Beer's criteria medications in elderly patients, synergistic effects from opioids and antidepressants, and prescribing cascades such as edema caused by calcium channel blockers, and subsequently prescribing diuretic rather than being recognized as a side effect of that calcium channel blocker. They should also look for comorbidities that increase fall risk, life expectancy, and the patient personal preference that might allow for deprescribing efforts that reduce fall risks. And also, when discussing deprescribing, pharmacists should do so in a way that does not harm the patient-prescriber relationship, and emphasize that deprescribing is recommended to achieve the patient's health goals, which is, in this case, the reduced risk of falling, and not because the patient isn't worth treating. For an example, when a pharmacist identifies a potential patient for deprescribing, it would be helpful to utilize the FRAME structure. FRAME is an acronym for Fortify Trust, Recognize the Patient's Willingness to Deprescription, Align Deprescribing Recommendations with Goals of Care, Manage that cognitive dissonance, and empower patients and caregivers to continue the conversation with their provider. And also, pharmacists should have a plan in place to initiate deprescribing safely in a stepwise manner and for monitoring any symptom reoccurrence once medication is completely discontinued. So one place to look is deprescribing.org, which has some great resources and algorithms for various disease states and classes of medication that might be helpful. And there are also tools that the CDC puts out like StopFall and Impact that can also be helpful in evaluating and recommending deprescribing.
Thanks, Nick. That's all great information. So start low and go slow is certainly my motto when it comes to older adults, and I think the same applies when you're deprescribing as well. All right, let's shift gears a little bit and Yara talk a little bit more about the USPSTF recommendation statement published in June. So, Yara, I know you helped me take a look at that statement and break it down a little bit. What are some key concepts that pharmacists should be aware of?
Yes, so compared to the U.S. Preventive Service Task Force in 2018, the new recommendation statements didn't change too much and still reiterate use of exercise program for patients who are at higher risk of falling and suggests offering multifactorial interventions such as medication management and home safety checks if appropriate. Now, the recent U.S. Preventive Service Task Force statement states that regular exercise has a decent impact on preventing falls and related injuries in older adults. However, those multifactorial interventions, such as the medication management, vision and hearing correction, balance and gait training, seem to only provide a small benefit. For older adults, the recommendation is 2 to 3 exercise sessions a week for a year. And if you're wondering what counts as enough exercise, the U.S. Department of Health and Human Services and the CDC suggest getting at least 150 minutes, and that equals 2.5 hours of moderate aerobic activity, or if you're more into intense workouts, you can do 75 minutes of vigorous exercise per week. And don't forget to mix in some muscle strengthening exercise, for example, lifting weights, digging in a garden, or even some yoga postures at least twice a week. As pharmacists, start by looking at what might be putting your patients at risk for falls. So that could be anything from balance issues to vision problems, the medications they're taking, or even how safe their home setup is. Based on that, you might recommend some exercise a few times a week or suggest other interventions like reviewing their medications, referring them to a specialist for vision and hearing, or suggesting some changes to their home environment. When you're figuring out if these medications are appropriate, make sure you're thinking about the 4 M's. And these are what matters: medication, mentation, and mobility. What matters is knowing and aligning care with your patient specific health outcome goals and preference. Mentation is preventing, identifying, treating, and managing dementia, depression, and delirium. Mobility is ensuring that your patient moves safely every day to maintain function and do what matters to them. And finally, looking into their medication. If it's necessary, age friendly, and or does not interfere with what matters to them, their mobility, or their mentation across setting of care. If you want to dive deeper when you're working to prevent falls with your patients, I encourage you to head over to the CDC for guides on fall prevention interventions, check out the NIH for information on fall preventions, or visit the USPSTF website for more information or recommendations.
Thanks, Yara, for taking a little bit of time to dive deeper into that USPSTF statement and really just giving a great reminder of some general principles as it relates to managing medications with older adults. For me, the biggest takeaway here is that even in our older adults, we should still continue to recommend activity in some form of exercise to avoid that sedentary lifestyle, deconditioning, and falls. Nick, what are some other simple suggestions that pharmacists can make when talking to patients they fear might be at risk for a fall?
Yeah, so one of the easiest things you can recommend for your patients is to know their space. Loose rugs, slippery surfaces like tile floors in the bathroom, unsecured cords are all known to be increasing fall risk. CDC, again, has excellent tools called SteadyRx that builds a coalition of patient, pharmacist, and physician to monitor fall risk in patients and make recommendations to prevent those falls through gait analysis, deprescribing efforts, and side effect management. So another thing you can remind your patients about is adequate hearing and vision are important things to be aware of. The ASCP Falls Reduction Checklist is a comprehensive tool that accounts for medications, medical conditions, general patient factors, living arrangements, and sensory function in patients as a supplement to the CDC's SteadyRx toolkit. So remind the patient of the importance of visiting their physician if they experience any hearing changes or vision changes, and to turn on lights and keep their glasses nearby at night if they're going to be getting up. Both of these tools are simple ways to assess polypharmacy, prevent those prescribing cascades I mentioned earlier, identify those high-risk medications that are going to be really, really risky for your patients, and potential synergistic effects that lead to increased fall risk in a clinical, ambulatory, or community pharmacy setting. Very easy to talk to your patients about at any given moment.
Thanks so much, Nick, for kind of tying that together with some key best practices. All right, y'all. So let's summarize major takeaways from our time here today. Falls are a major cause of morbidity and mortality in older adults, and a contributor is polypharmacy, which may lead to things like hypotension, dizziness, and confusion. Pharmacists can use their expertise to promote safe and effective medication use, but also offer things like exercise interventions and other non pharmacological interventions like removing rugs and unsecured cords from the floor to minimize the risk of falls. All right, folks. Well, that's all the time we have here today. So look out for part 2 of this month's First Fill podcast that will release next Thursday. Teaser will be speaking with Sean Jeffrey, a geriatric pharmacist from the University of Connecticut. I can't wait to introduce you to him. For any BCGP credentialed pharmacists, we've also recently released a case study on fall prevention, and we also have a free case study in our library on the 4Ms. Check that out for sure to earn 1.5 hours of BCGP recertification credit towards your credential. And last but not least, don't forget to head over to the Learning Library at learn.pharmacist.com to earn your CE for this month's podcast. We'd love to hear your feedback on how you like the new setup. Thanks and take care.